Applestosen. It's Dr. Bob Graykowski here with another health and vitality tip of the week. So a lot of people don't realize that one of our specialty here at Chiropractic USA is head trauma patients. We have lots of patients that are in car accidents or have direct head trauma. We have patients who have been football players, fallen off of high buildings, to getting actually hit in the head with a baseball bat. And a lot of times it actually shifts the bones of the skull. A lot of people do not realize that we have 22 bones of the skull that make up the protective mechanism of the most important organ in your body, your brain. So if one of these bones shifts out of alignment, you can actually feel the areas where that are called sutures. It's kind of like the hinges where the bones have to flex and bend. The skull has to actually have some flexibility for the brain and swelling. If you have a trauma, it can actually torque and twist these areas. If you do cranial work, specifically work along the sutures and areas to allow taking stress off the jaw, the sphenoid bone, all these different areas, it regulates better circulation to different parts of the brain. The interesting thing about our skin and our nervous system is they come out of the same set of cells when we are developing as an embryo. So there are certain points on the skin that will stimulate different parts of the nervous system. It's one of the basic premises behind acupuncture and acupressure, but cranial work is very specific to affect the bones of the skull, to affect the circulation in different parts of the skull, to affect the drainage of the sinuses and the lymph system, and to affect and stimulate the nervous system. So if areas are suppressed or destimulated, we want to increase the activity. If they're overstimulated, we want to suppress or decrease the activity. Patients that we see in our office can be anything from little kids with attention deficit, autism, head trauma patients, to even our Alzheimer patients or dementia patients that can benefit from cranial work to increase the circulation. Many of our patients come in because they have chronic sinus problems, or they've got problems with their tear ducts, or problems with their TMJ, their jaw. So a proper evaluation of the skull and the jaw and the upper cervical area are so important if you're going to looking at the cause of potential health problems. Headaches, dizziness, ringing the ears, sinus problems, and these other conditions mentioned are also signs and symptoms that a person could have a problem with a head trauma. If you've had any type of injury to the head or upper cervical area, make sure that you get this properly evaluated, especially from a chiropractor that does cranial work and upper cervical work, to make sure that you get to the core of the problem to allow better circulation. If you have a problem that is uncorrected, this can lead to diminishing brain function as we get older. So it's never too late to get an evaluation. So get one today. This is Dr. Bob signing out with another health and vitality tip of the week. Applestosen.